The tip of the iceberg. What really drives aging and frailty? When a patient arrives complaining of weak legs, unsteady balance, or fear of falling, we tend to see the problem clearly. We measure grip strength, record gait speed, note bone density, and assign a diagnosis: sarcopenia, osteoporosis, frailty. The picture appears manageable. What we are actually seeing, however, is only the surface, the visible tip of an iceberg whose bulk has been forming silently for decades. Beneath the waterline, a cascade of changes has been underway long before any complaint reaches the consulting room. Muscle fibers undergo denervation and are gradually replaced by fat and connective tissue. Collagen and elastin structures in fascia and tendons alter their properties, changing how forces are transmitted through the body. Vessel walls thicken, microcirculation deteriorates, and a state of chronic low-grade inflammation becomes the new baseline. The nervous system contributes its own changes: slower conduction, less precise sensory feedback, and increased background noise that burdens attention and cognitive control. Layered over all of this are decades of lifestyle patterns: physical inactivity, accumulated sleep debt, chronic stress, that quietly shift the body's settings year by year. What finally appears as sudden weakness or a first serious fall is rarely sudden at all. It is the moment when years of small structural concessions become impossible to conceal. This perspective invites a more fundamental question: what is actually aging? Not individual organs in isolation, but the way the whole system coordinates, distributes resources, and maintains its safety margins. Frailty is not simply the sum of tissue damage. It is the loss of a system's capacity to compensate efficiently for minor disturbances. Sarcopenia is not only about mass. It reflects how the brain recruits and uses muscle. Osteoporosis cannot be understood apart from loading patterns, hormonal context, and inflammation. Seeing beneath the waterline does not make the visible losses any less real. But it changes what we look for, what we measure, and ultimately what we can do, before the iceberg surfaces.